Good afternoon, everyone. And today we'll be talking about gender dysphoria by Robert Bunn and Ambria Anderson. So, what is gender dysphoria? Well, gender dysphoria is defined as a conflict between a person's physical or assigned gender and with which he, she, they identify. This causes the individual to be very uncomfortable when assigned gender. In the previous DSM-4, gender dysphoria was termed as gender identity disorder. It did focus on dysphoria, however, much so as a clinical problem, not as an identity. Whereas the DSM-5, gender dysphoria's current term is more descriptive than the previous one. So, how is one diagnosed with gender dysphoria? Well, in the DSM-5, the criteria for gender dysphoria is based off of an incongruence between one's expressed gender and assigned gender. This person must have at least 6 months of a duration and manifested by at least 6 of the following for children. Whereas for adults and adolescents, only 2 criteria are needed to be met in order for an adult or adolescent to have gender dysphoria. Gender dysphoria in children has 8 criteria, but only 6 are needed to be met in order to diagnose a child with gender dysphoria. So let's go down the list. 1. A strong desire to be of other gender or insisting that you are of the other gender. 2. A strong desire of wearing clothing of the opposite gender. 3. A strong preference for cross-gender roles in make-believe play or fantasy play, like role-playing. 4. A strong preference for toys, games, or activities used by the other gender. 5. A strong preference for playmates of the other gender. 6. In boys, a strong rejection of typical masculine toys, games, activities, and avoidance of any rough and tumble play. In girls, there's a strong rejection of typical feminine related toys, games, or activities. 7. A strong dislike of one's sexual anatomy. And 8. A strong desire for the physical sex characteristics that match one's expressed gender. All of these are the criteria for gender dysphoria in children. Now we'll be moving on to gender dysphoria in adults and adolescents. In order to be diagnosed with gender dysphoria, you only have to meet 2 of the criteria versus for children, 6 have to be met. But it still does do the 6-month duration. So let's go down the list. 1. A marked incongruence between one's expressed or experienced gender and primary or secondary sex characteristics. 2. A strong desire to be rid of one's primary and or secondary sex characteristics. 3. A strong desire for the primary or secondary sex characteristics of the other gender. 4. A strong desire to be rid of the other gender. 5. A strong desire to be treated like the opposite sex. And 6. A strong conviction that one has the typical feelings and reactions of the other gender. On this page, there's a continuance of symptoms for a person who has been diagnosed with gender dysphoria. So, gender atypical behavior is common among young children and may be part of normal development. Children who meet the criteria for gender dysphoria may or may not continue to experience it until adolescence and adulthood. Please note that some research shows that children who have had intense symptoms and distress, who were more persistent, insistent, and consistent in their case gender statements and behaviors, and who use more declarative statements. I am a boy or girl, rather than I want to be a boy or girl, were more likely to become transgender later on in life. Now on this page, we'll be discussing or talking about a few risk factors for people who have gender dysphoria. So, we have borderline personality disorder, post-traumatic stress disorder, we have depression and anxiety, self-hatred, dissociative disorders as well. Etiology and neurobiology. There is no known cause for gender dysphoria. However, genes, hormonal influences in the womb, and environmental factors are all suspected to be involved. Gender dysphoria varies with age, but for children, onset of cross-gender behaviors usually start between ages 2 to 4. Children are defined in a more concrete behavior manner versus adolescents and adults. Young children are less likely than older children, adolescents, and adults to express extreme, persistent anatomic gender dysphoria. Early onset gender dysphoria starts in childhood and continues into adolescence and adulthood. Late onset of gender dysphoria occurs around puberty or much later in life. Prevalence and sex ratio. Please note that many of the percentages and ratios for children, adolescents, and adults are just modest underestimations of what really is happening, just because some do not seek hormone therapies or surgical treatments. As we start to conclude our presentation on gender dysphoria, I do want to just take note and let you guys know that the sad reality of gender dysphoria would be that many people suffer from harassment and abuse, are in violence or have violent relationships, are in poverty, unfortunately have HIV and AIDS, and are discriminated against because of their sexual orientation or preference. Differential diagnosis, nonconformity of gender roles, transvestic disorder, body dysmorphic disorder, schizophrenia, and other psychotic disorders. Other clinical presentations. It is important to note that a person with gender dysphoria can be diagnosed with other disorders. These disorders may be similar to the DSM-5 gender dysphoria criteria. Comorbidity. In clinical referred children with gender dysphoria show elevated levels of emotional and behavioral problems, most commonly anxiety, disruptive and impulse control, and depressive disorders. In clinically referred adolescents with gender dysphoria appear to have other mental disorders, which include depression and anxiety being some of the most common. In clinical referred adults with gender dysphoria, many may coexist with other mental health problems, most commonly also as anxiety and depressive disorders as well. Diversity surrounding gender dysphoria. All races and ethnic groups are affected by gender dysphoria. Many cultures around the world or worldwide have started to accept the term gender dysphoria and offer support groups and other organizations to help these individuals. Sadly, the stigma within religious communities has not changed, and some are accepting, but others are not. Finally, we have treatments for people who have gender dysphoria. Counseling, cross-sex hormones, puberty suppression, and gender reassignment surgeries are all among the type of treatments people can receive. Please note that counseling for parents with children with gender dysphoria is the best method starting off as support. Children with gender dysphoria have a slightly different treatment because of some of the feelings they do have as a child may not be congruent with how they become or evolve into adolescents and adults. This concludes our presentation on gender dysphoria. If you have any more questions or concerns or just want to know more about it, please feel free to reach out to me or Robert. Thanks, you guys.